Hey everybody, Dr. Cat here with this week's Chiro Chat. We think we're live right now. Tess isn't quite sure how to run the camera. Say hi, Tess.
Hi.
This week we just wanted to touch base on how do you know where people should go? Who do they need to see as a provider for whatever issue is going on? And we see this a lot in here. People come in with something, oftentimes something they maybe don't think that we can address for whatever reason because it's not like a musculoskeletal problem, say reflux, for example. But people are oftentimes even afraid to tell their MD, their conventional medical provider, that they are seeing someone like us. And I would say to that, don't ever be afraid. They need to know, simply because there's other people laying hands on you and being involved in your health. That being said, who do you know who to go see? To me, as a general rule of thumb, it takes a village to raise a patient just like it does to raise a child. So you may have things going on and there are multiple aspects to how your body runs. So it's okay if there are a couple extra hands in the pot, so to speak. So we may be seeing you, and by all means, if we see something that we think needs to be addressed on a more significant level than we can do, we are going to tell you, hey, go see your MD, or hey, go see this ortho, or hey, go see the physical therapist, whatever the case may be. We try to have some relationships with those, and we love if people have a doctor that they love to share that info with us so that we can then pass that on to other patients. But it's okay if you need to see more than one person for something. It's okay to tell your MD that you're seeing us.
And it's certainly okay, and a matter of fact, mandatory to tell us what other treatments you're getting for
Exactly.
Lots of conditions, not just what we're seeing you for. The more we know about what you're doing, the better we can help you.
Exactly.
Hi, Rita. Hi, Peter.
Hi, Rita. Hi, Peter. So anyways, keep us informed as to what's going on, and don't be afraid to ask questions, and don't be afraid to get multiple opinions. There's a lot of different ways to address the things that are going on in your body. Chiropractic is addressing not only the biomechanical aspect, right, the actual joints moving like they should, it's also addressing how your nervous system is reacting and telling your system how to address certain issues. But you've got nutritional aspect, so that's another thing that you might be looking at. You may need to get medical intervention if you've got something that is so significant that we need to get it under control so your system actually can start the healing process. You may have something that actually needs a surgical intervention. That doesn't mean you don't necessarily need chiropractic care. That just means that it's going to be an adjunct. So they're going to work together. You don't ever feel like you have to have one or the other, because your health needs to involve whatever it needs to get you better.
And as chiropractors, we are trained to recognize things that need to be sent to other providers.
Correct.
And we are making connections more and more every day to have a network of people to make sure that you're getting the care you need, even if it's outside of our office.
Exactly.
And I love speaking from behind the camera. I'm much more comfortable here.
So that wraps up this week's Chiro Chat. We will see you guys again next week. Bye.
Bye.